We start? Hurry up, please. Yeah, KT and the Citizen. Tuende. So, tuko sawa tuanze? Thank you. So, ladies and gentlemen, members of the Fourth Estate, thank you. Welcome to our press conference. My name is Dr. Thuranira Kaugiria, the branch secretary, Nairobi branch. With me, our KMPDU leaders, our chairman here, Dr. Deogratius Maero, our treasurer, branch treasurer, Gloria, our vice chairperson, PJ Murioki, our deputy secretary general, Dr. Malindi, and our acting assistant secretary general, Dr. Miskela. So we are here, number one, to issue a strike notice. We are here to issue a 7-day strike notice to Nairobi Metropolitan Services and Nairobi City County Government because of the sorry state of affairs that is going on within Nairobi County. From today henceforth, we have 7 days. Friday, 21st August 2020 at 8 a.m., our strike starts. These are our grievances. So it is of importance to note that for the last 2 months, doctors working within the Nairobi City County Government have not had a medical cover. Essentially, what I'm saying is that we cannot be able to afford the service that we offer. So I've been forced, whenever we contract COVID or we become sick, to contribute amongst ourselves to sort out our medical problems. From 1st of July, we have not had a medical cover. Number two, we don't have an isolation facility for where us as doctors will be isolated within the county. As you all know, the whole of Nairobi County has 16 isolation facilities for patients and general public in this county. The third point is that we have 5 specialists who have been working at Mama Lucy Kibaki Hospital. Their names are in the statement that you'll see, that have not been paid for 26 months. We have 5 specialists who have been working for more than 26 months. That's 2 years and 2 months without pay. We also have 2 doctors who have not been in the payroll and needs to be reinstated. They have not had their salaries between 19 and 22 months. There is a persistent issue of salary delays. As you all know, we have not been paid our June salaries. Our May salaries were paid, we have not been paid our July salary. Our June salary was paid on July 20th. There's an issue of job group promotions and job group redesignations, whereby we have senior doctors in this county who have been working in Nairobi City County for the last more than 16 years, who have their job groups, they are in wrong job groups, they need their job groups upgraded. We all know that the last promotions that were done by the Nairobi County Public Service Board was done for only one job group to disguise us that they are doing something and they are not doing something. We have a signed collective bargaining agreement for 2017-2021. The collective bargaining agreement stipulates the terms and conditions for healthcare workers, how they'll be working. I'm here to record that the collective bargaining agreement has been registered in court, and more importantly, that the Nairobi City County Government and Nairobi Metropolitan Service has not implemented anything when it concerns to it. My last point is to talk about the poor PPE, quality of PPEs that we are getting in our facilities. We have been getting very poor PPEs. Part of it is the reason why we have more than 10 doctors who have contracted COVID. We have some of us who have been admitted in MPSHA, some in Kenyatta National Hospital. Not forgetting that at the end of it all, we have to pay our bills, whether we go to a private facility. So those are the complaints that we have. So we are here as the leadership of Nairobi doctors, endorsed by our membership, more than 300 doctors, and the leadership of more than 10 doctors, to say that we are issuing a 7-day strike notice. That is, the strike will start on 21st of August 2020 in the morning. We have given them their grievances. Further, the strike notices have been served in the said offices. So they have 7 days starting today to resolve their crisis, or else we go on strike. Let me tell you, the last statement is that doctors are not martyrs. We are not martyrs. We are not children of a lesser God. We are equal humans who should be treated as is. During this COVID pandemic, we need to be treated as human beings. We are not children of a lesser God. We are not martyrs. Thank you so much, and I am Adisa. Any questions? Hey, Raquel. Thank you, Raquel. We have a lot of respect for Dr. Oluga. He's our former Secretary General. He's currently the Chief Officer, Nairobi Metropolitan Service. We have a lot of respect to him. He has been my friend for a very long time. We have shown him all these grievances. Part of the problem that is going on is that the Nairobi City County government is busy frustrating the Nairobi Metropolitan Service. They have not handed over the payroll on HR instruments. That's why we are here. So it's up to the two levels of government, national government and the Nairobi Metropolitan Service, and Nairobi City County government to come together and resolve this problem. All we want is solutions. We don't care who sorts it out. But on the 21st of August, we shall be on strike. Yes, sir. Thank you, Sarah. So essentially, we have been having poor quality PPEs that have been dropped at various hospitals in this county. More importantly, at Mama Lucy Kibaki Hospital, whereby we have had doctors improvising personal protective gear. One of us here, Dr. Morioki, works there and is one of the people who have been involved in that exercise of improvising PPEs. It is so unfortunate, it is so wrong that is happening to some of us in this day and age. Essentially, what should happen is that we should be given high-quality PPEs. And at this moment, I have to thank Dr. James Mwangi of the Equity Foundation. The PPEs they have been supplying us have been of high quality. I feel very bad that the government has abdicated its role until a private entity has gotten into this exercise, and it is working through KMPDU to supply our doctors with personal protective gear. We want to hope that starting today that we shall be getting quality PPEs. And to your second question, how many doctors? We have more than 15 doctors who have contracted COVID positive in the county. We have more than 80 nurses in the county that have contracted COVID disease. Even clinical officers, we have them, just because of the quality of the PPEs that we are getting. It's time now we say no. And we are saying no, that we want all that problem sorted out. Thank you. Yes, please. Supply for PPEs. It has been erratic. The supply for PPEs has been erratic. You might know that luckily within the last 2-3 weeks, we got some few donations. Number one, from ourselves as a union through GSK. They gave us some few PPEs that we supplied to our doctors. Then number two, we have what was supplied by the Equity Foundation. So the supply for now is adequate, but it's been waning on all along, yes. And I think my parting shot is to say, at the end of it all, I encourage the government to sort out. They need to take doctors seriously. There are many problems happening in the country. Many counties have problems. We well know that Nakuru County also has a problem. It's a countrywide problem. Kindly come and avert a nationwide strike. I'll give my boss, my acting Secretary General, a moment to say a thing. Thank you so much. And let's not forget, doctors are not martyrs. Doctors are not children of a lesser God. Thank you.